and last but not least. My name is Rpiw, and I'm the Director of Pharmacy for the Prince Albert Parkland Health Region, and I had the great honor of leading this wonderful team, WKRP 63. And don't ask me what. So we are speaking to a tack time of 20 minutes. So this is a picture of our outstanding team, and I don't do any characteristics like everybody wearing glasses. But we had a great representation from the Herb Bassett Home and HR, and along with some support from many others. So this is our project form. Our team was tasked with developing tools to support the increase of staff morale and to decrease sick time in the Herb Bassett Home in order to provide safe, quality care to the residents. So it was identified that the Herb Bassett Home has a high usage of sick time, and sick time, of course, takes staff away from our patients and residents. So our team looked at the root causes of the usage of sick time at the Herb Bassett Home by talking to the staff through surveys and focus groups. So as where every improvement project should start, our team started with some data from last year. So what we know is that between 3 and 22% of the time, shifts are not able to be covered when staff call in sick, and sometimes they were only able to be covered part of the time, as there was no one available to work. This affected patient care, as things would have to be delayed. There was 14,563 sick time hours and about $650,000 spent on sick time and the overtime required to cover that sick time, just in a 10-month period. And also, employees who are under the regional sick time goal do not receive any recognition. Health prevention and wellness practices by staff in the region are not optimal. For example, only about 50% of regional staff got a flu vaccine this past winter. Staff are feeling that their workload, rotations, and assignments are leading to stress, fatigue, and repetitive injuries. Outbreaks and chronic illness contribute to sick time usage, and decreased morale and teamwork contribute to sick time. It is hard to provide safe and quality care to our residents when all these things affect our staff. So we needed to look at what we could do to improve the situation.
My name is Ricky Skippington. I'm a registered nurse at Public Health, and I'm a lean leader working on my recertification. So our very first day that we showed up, we were presented with some ideas that had come from a focus group. So this was a focus group that Lori had done in her second week of Rpiw prep. And basically each group was one per unit at the Herb Bassett Home, and they generated some really good ideas for us. So one of the things they had was they really felt they needed to be educated more about the types of leaves that they could access and the appropriate use of them. So family leave, pressing necessity, if vacation, LOAs, or if they had bank time. So how do they use those, when can they use those? So you'll hear a little bit more about that with some wellness talks that we have planned in a few minutes. Another idea was to assist managers with applying the sick time usage policy. And then some key ideas that I'm going to talk a little bit more about is we're focused on team building and increasing staff morale. So they talked about wanting to joke a little bit more, laugh a little bit more, feeling truly valued. And they wanted a bit more in terms of social events to really help with that team building. And so they wanted more Herbie cups. So behind me you can see, this is an idea sheet that shows how they would like to have more Herbie cups. And I'm going to tell you what those are in just a sec. But they really felt it would increase staff team building, and the last cup was actually held in the fall of last year. So the Herbie Cup has been around for about 7 or 8 years, and it was actually 2 nurses at the Herb Bassett Home, one of which is Maureen, who you're going to hear from a little bit because she's on our team, who in their own time and using their own resources came up with this Herbie Cup, where they would do some activities to kind of create a better staff morale, a little bit of teamwork. They would do things like scavenger hunts, Easter egg decorating contests, Winter Olympics, Pictionary, and they made some scarecrows one time. So you can see they're playing some type of Bruno thing in the hall there, and you can definitely see by the pictures that staff morale was up. But most importantly, the residents really enjoyed watching when they were doing these and assisting with them. When they did the scarecrows, they helped make these scarecrows. So ultimately, it's all about the residents. So yes, it increases staff morale, but it comes back for its entertainment for them as well. So we started off doing a survey to see what staff thought about this, if the focus group was right and they liked it. There were 11 surveys completed, and 9 people liked the Herbie Cup. One person had never participated, but a coworker explained it. They thought it sounded like a great idea, and it definitely would help with improving and having everyone work as a team. The most frequent suggestion was to have it every 2 months. 9 agreed that weekends did work best. And there was a suggestion to use some of the bottle money that they collect on each pod towards using some of that to kind of do prizes and that type of thing. Turns out, while it was a great idea, they do use that money to feed the pets that they have there, so they need to eat. So Fred came up actually, our patient rep, with a really great idea for popcorn sale. So this is a sign that we have. The thought that he had was that, anytime he's ever gone to a care home or even Rona, and you walk in and you can smell that popcorn, it's a warm, welcoming smell. Most people have a good memory that they associate with popcorn, and the pods have done popcorn parties, and it seems to be a big hit with the residents. So it is something that they have, and there is a machine that the Herb Bassett Home has. We thought $1 a bag would offset some of the cost for the supplies for the event, as well as having prizes, and that some of the volunteers could help with the sale of it and the making of it. You can see that there's the cup on the far side. This is actually the Herbie cup. The original cup was an improvised trophy. I say that very loosely. They came up with it using their healthcare worker sense of humor and supplies on hand. So you can picture what that would be. The new cup is a little bit more polished, and it is a great sense of pride for that pod that wins it, because they have it until the next Herbie cup. So we did come up with some terms of reference for this group. There will be the 2 co-chairs as well as a rep from each area, so that everyone's represented and it can rotate through and come up with different ideas.
Hello, my name is Brittany Hill, and I'm a CCA on Paradise Path at the Herb Bassett Home, and I'm going to tell you about the welcome cards we made. You can see behind me there is an idea sheet. When a new resident arrives and is overwhelming and scary for them. Okay. Giving them a welcome card is a friendly way to welcome them to their new home. The next idea shows how new staff members can feel overwhelmed, scared, and worried about starting a new job. I can still remember starting on my new job many, many years ago, and it was intimidating, scary, and nerve-wracking. By giving them a welcome card, it lets them know that we are here as a team and they're not alone. This is a card we developed and is located on each pod and is easy to find. We had some staff trial the card out for a new staff member and a new resident. There were 6 feedback surveys completed for this. All 6, it was a good idea and it would help the staff morale. Some comments they had were, I feel good inside, it made me feel appreciated and welcome. These are the work standards we developed for when a new resident and new staff member arrives. We want to make sure they feel that they are received and are welcome. When we were first told the staff about the welcome card, they were pretty pumped and immediately grabbed the cards for the new resident.
Hello, my name is Pat Scobie and I'm a CCA at the HPH. I'm speaking to all to a thank you card that we have developed. Behind me you can see an idea summary sheet. This came from a focus group suggesting staff morale was low and they felt stressed and underappreciated. So you can see that when a thank you card is given, it brightens their day. This is the card we developed. They have been placed on each unit so they are easily accessible to everyone, staff, residents, and their families. The card was trialed and a survey was done, and of the 4 responses that were returned, all thought it was a good idea. Some of the comments were, it made me feel good, I think it will make everyone happy, it makes me feel better because at the end of the day, I know that I've been appreciated. This is the work standard that shows how a resident or family member can access a card, and this is the work standard that shows how a staff member can access a card. Everyone we talked to about the thank you card thought it was a great idea, and we're very excited to use it.
I'm Charmaine McKnight. I'm an LPN at the Herb Bassett Home. Here we had the idea of bringing up a motivational board. Some of our units do have it, but now all of our units have it. And a quote or phrase can cause our minds to think or act differently. Our goal with these boards is to cause ourselves, as well as others, our coworkers, to build encouragement and a strong team. It lets us take ownership of our workplace and share our positive attitude within the home. This will create a better, satisfying atmosphere, we hope, for our staff, residents, and family to build staff morale. We have developed a work standard. Oh, sorry, can you go back? So this is just an example of one of the ones that are showing up on our pod today. We have developed a work standard to direct this as an ongoing basis. And weekly input is desired.
What happens when you get old and you have to limp to the front. So, anyhow, greetings. My name is Fred Barr. I'm a patient advisor. What I heard as a patient family advisor was that staff morale was low. It's a Herb Bassett reason for several reasons. Collective agreements, right through to interpersonal relationships. It is the latter reason that the group focused on, the interpersonal relationship. What does low morale mean to me as a patient family representative? Low morale to me means that the goals of the Herb Bassett are not clear, relating to staff commitment to co-workers, which results in absenteeism, which in turn provides inconsistent care to the residents. And note, you had looked at 3 to 22% of the people are replaced, and when they are replaced, then the people coming in may not know the routine of the hospital, and this affects resident care. Quoting Donald Trump, the most recent president, this is very, very bad. Commitment to co-workers. We developed a commitment list, and you can read it later. We're going to post it in creative places, let's say. The area that is of particular interest is I will not engage in the 3 Bs, bickering, backstabbing, or blaming. But I will participate in the 3 Cs, caring, commitment, and collaboration. So that is what a pledge is, and a commitment. And now I'd like to quote another president of the United States. Commitment is what transforms the promise to reality. And by those simple steps, we hope to improve the care to the residents. Remember, the staff has to be there in order to provide the care. And so, simply as a family rep, that's very important to us.
It's going to be tough to follow Fred. I'm Rpiw, I'm manager of applied health, safety, and wellness. It's not very often someone tells me to speak up, but this is the idea summary sheet, as you can see here. I was very lucky. This is not one that I had to design. It was already designed in advance. I think that comes from some of the frustration maybe around the lack of information, or where do we find the correct information. So my task was, as you can see, is this poor person is a manager sitting with all those question marks on top of their head. Is who do I contact in HR related to all types of departments? Specifically, my goal was, who do you contact in the event of the attendance support program, and who is the disability management consultant, and what role do they play in helping reduce the sick time? So the first thing I developed was a flow sheet for the Herb Bassett Home. Coincidentally, Pineview Terrace 2 will reap these same benefits because they have the same person assigned. For Frank's, I guess for continuity, we have the same person assigned, so you'll see that the flow sheet will state who the disability management consultant is and what their role is and what they can help them with, float out. And the next what I did was, and again from that frustration or what I heard from this week from some of the managers was that the frustration they had on how am I going to use that attendance support program. We've talked about it, I've seen it, I know where it is. I don't want to read it, just tell me what I should do, what it looks like and what it's about. So again, developed this work standard this week that as a tool and a quick checklist for those managers that want to see. This is an attendance support program that's been in effect here for almost 3 years. It's available to you. Those that use it could probably speak that it is a very welcomed asset in your processes related to that. And now this is the standard work that Frank will be sharing back with his managers on how to move forward and to keep themselves active in that program.
Hi, I'm Karen Pellerin. I'm a CCA from the Herb Bassett Home. As a care provider, my focus is always the resident. Increased sick time may make our clients feel like burdens. Increasing morale will hopefully increase attendance, leading to a direct impact on the health and well-being of our residents. This is our work standard for our management team for recognition of employees with good attendance. Staff with less than industry standard for sick time will be entered into a draw. They will receive this certificate. We also contacted third-party stakeholders to provide gifts as incentives for recognizing the individuals. To encourage a team approach for morale, we developed an award for the unit with the least amount of sick time that can be placed at the entrance of the unit that achieved best attendance. These awards will be awarded quarterly.
Hi, my name is Maureen Dunn. I'm a registered nurse at the Herb Bassett Home. It was recognized that there are many resources that are available to staff that staff are unaware of or need assistance in accessing every day to wellness. A prime example of this is the Employee Family Assistance Program. Given the large amount of staff that we have, which I believe is in the 150 to 170 range, the need to be informed of things, it was felt that we could utilize Tuesday morning huddles to educate and encourage staff. And thus Tuesday talks will be initiated this coming week. We've developed a work standard. We developed 3 topic categories and a content schedule, and we briefly researched and provided a resource folder for managers that support the topic categories. Our expected outcomes are having informed staff, supported staff, and doing some team building.
So the newspaper highlights what we worked on this week and shows that we were able to complete 8 out of our 12 ideas during the Rpiw week. One of the items not completed but will be completed by the end of April is a 5S of a room to create another staff room that is more available to staff from 2 of the units. So our target progress report. The target progress report shows the measurements that we started this week. And we primarily were looking at quality in our groups. We don't have a lot of numbers, but this will be what will be monitored over the next few months to see if our improvement ideas are continued. We want to ensure that all new staff receive a welcome card when they start working at the Herb Bassett. So we already have one. So in summary, the WKRP 63 Rpiw team was able to implement several tools this week. To make the Herb Bassett Home an even better place for residents and their families, the morale boosting tools will help increase the morale of staff and management. We created motivational boards that complement current recognition boards on the unit. We created welcome and thank you cards. We recognized the value of the Herbie Cup. We created a commitment to my coworkers poster. We helped managers by creating a wellness and attendance package with clearer direction for navigating the HR system. Plans for the Tuesday wellness talks. and created an employee recognition program with attendee certificates for individual staff and award for the unit with the best attendance for the quarter. I would like to thank my team for doing such a great job, and they epitomize teamwork this week. I can see a better future with them helping to lead the way for teamwork ideas at the Herb Bassett.
So we have many thank yous as a team. We want to thank the staff at Employee Health, Safety and Wellness and Human Resources for their assistance with us. The Herb Bassett Home managers, Director of Care, staff, and especially the residents. Cynthia for her superb continuous improvement office support and guidance. Our fearless leader, Lori, all our team members, and especially Fred, who always helped us bring it back to how is this going to better affect the residents. And also for this morning when we were all nervous about speaking, his sense of humor shined and he just put us all at ease and we greatly appreciate it.